continuing with the brachial plexus, as we have seen that C5, C6, C7, C8 and T1 contribute to the brachial plexus. 5 and 6 join, 8 and T1 join, and they form upper, middle and the lower trunks. These are the roots and these are the trunks. So we will be seeing the C5, C6, C7 forms a long thoracic nerve. So now in this talk here we will be discussing the topic of injury to the trunks and the long thoracic. So the first one to be discussed is the Erb's palsy. That is the upper trunk injury. Upper trunk can be injured with traction or tear. That is traction in infants when you are during the delivery, or tear or trauma in case of adults. Second to discuss is your Lumbricals palsy. Lumbricals palsy is the injury to the lower trunk, again because of traction, pulling the hand in infant during delivery, or trauma when somebody is falling from a tree and trying to grab the branch can lead to traction, the trauma to the lower trunk, that is Lumbricals palsy. Third to discuss is the Thoracic Outlet syndrome. We must know about the scalene triangle and how the lower trunk is passing from there. And here in the scalene triangle, there can be compression to the lower trunk along with the compression of the subclavian vessels. And fourth point of discussion here is winged scapula. Winged scapula is injury to the long thoracic nerve. How? In case of when somebody is performing a mastectomy and you are removing the axillary nodes, or a stab wound to the lateral side of the thorax can damage the long thoracic nerve, which damages the muscle serratus anterior. Okay, so Erb's palsy, traction, tear, upper trunk. Now the upper trunk supplies the deltoid, supraspinatus, infraspinatus and musculoskeletal nerve, that is the bicep. So muscles supplied are deltoid, supraspinatus, infraspinatus and bicep, that is the supplied by the musculoskeletal. Now the lower trunk supplies the intrinsic muscles of hand. Same here, intrinsic muscles of hand. So let's start with the Erb's palsy. See, if your deltoid is responsible for the abduction and supraspinatus is responsible for the first 15 degree of abduction. So if deltoid and supraspinatus, both of them are not working, what will happen? There will be no abduction, so the hand will be hanging. Now the infraspinatus is responsible for lateral rotation. So if it is not working, the arm will be medially rotated. The bicep is responsible for flexion. So if it is not working, limb will be extended, and it is also responsible for supination. So if it is not working, limb will be pronated. So your hand will be hanging, medially rotated and pronated. So it will look like waiter's tip. So Erb's palsy is also called as waiter's tip. So it will be extended and pronated. This all will appear like somebody standing like this, his feet is here, the arm will be like this. It is called the waiter's tip. Next is trunculus palsy. Intrinsic muscles of the hand include the thenar, hypothenar, lumbricals and interosseous. Our point of concern here is the lumbricals. The lumbricals flex the metacarpophalangeal joint and extends the PIP and DIP. So your hand will look like this. That is flexing of, it flexes the metacarpophalangeal joint and it extends the PIP, proximal interphalangeal joint, and DIP, distal interphalangeal joint. So if this is damaged, what will happen? There will be extension here, extension seen here and flexion seen here. So what will it look like? There is extension here and flexion here and here. So it will look like this is the metacarpal. This will go like this, extension here and flexion here and flexion here. So the hand will look like a claw. So that is why trunculus palsy is also called as claw hand. Similarly, in thoracic outlet syndrome, compression to the lower trunk and the subclavian vessels can occur because of number 1, Pancoast tumor, that is the tumor of which is taking place in the apex of the lung and can damage the lower trunk, and second is your cervical rib. Now, if the in subclavian vessels, if artery is damaged, there will be lot of pain. If the vein is involved, there will be lot of edema. It's very similar to this thing. Now, winged scapula, because long thoracic nerve is damaged because of removing the axillary lymph nodes in cases of mastectomy or because of a stab wound, what will happen? It supplies serratus anterior, and serratus anterior is useful or helpful in anchoring the scapula to the thorax. So that will not occur. So there will be winging of scapula, and secondly, if somebody is standing, if you have to abduct your arm from horizontal position, serratus anterior is helpful. So the person will not be able to know abduction of arm from horizontal position. So if serratus anterior is damaged, there will be two problems. One of them will be winging of the scapula, and the second one will be there will be no abduction from the horizontal position. So these are the problems with the trunks of brachial plexus: Erb's palsy, trunculus palsy, thoracic outlet syndrome, and winged scapula.